As we age, our bodies naturally go through changes. But one area many people overlook, until it causes pain, is the spine. In this video, we'll explore what spinal degeneration is, why it happens in older adults, and what can be done about it. 1. What is spinal degeneration? Spinal degeneration is a condition that affects the structures of the spine, most commonly the intervertebral discs and the facet joints. These structures are critical for movement, flexibility, and shock absorption. When they begin to break down, the spine can become stiff, unstable, and painful. Let's start with the discs. Your spine is made up of 33 vertebrae, and in between most of them are soft, cushion-like discs. These discs act like tiny shock absorbers, allowing you to bend, twist, and move comfortably. Each disc has a tough outer layer, called the annulus fibrosus, and a gel-like center, called the nucleus pulposus. Over time, and especially as we age, these discs begin to wear out. They lose water content and become less flexible. The once soft center becomes dry and less able to absorb pressure. This process is what we call degeneration. When discs degenerate, they can shrink in height, which brings the vertebrae closer together. This increases the pressure on the surrounding joints and nerves. It can lead to stiffness, pain, or even nerve irritation. In addition to the discs, the facet joints, which are the small joints at the back of the spine, can also become arthritic. This condition is known as facet joint osteoarthritis, and it can further contribute to back pain and limited motion. You might also hear the term degenerative disc disease, but don't let the word disease scare you. It's not an infection or contagious. It's simply a term used to describe the natural wear and tear of the spine as part of the aging process. In fact, most people over the age of 60 have some degree of spinal degeneration, even if they don't have any symptoms. Sometimes, degeneration can lead to the formation of bone spurs, also known as osteophytes. These are bony growths that develop around the edges of the vertebrae. While your body creates these spurs to try to stabilize the spine, they can end up pressing on nearby nerves, causing pain, numbness, or weakness, especially in the arms or legs. In more advanced cases, the degeneration can cause narrowing of the spinal canal, a condition known as spinal stenosis. This can make it harder for the spinal cord and nerve roots to function properly, leading to more serious symptoms like balance problems or difficulty walking. It's important to understand that spinal degeneration isn't something that happens overnight. It develops slowly over many years. It might begin with mild stiffness in the lower back or neck. Then, you might notice occasional aches or pain after standing or sitting for long periods. In some people, the pain becomes more persistent or even disabling if not managed properly. The key takeaway here is this: spinal degeneration is a normal part of getting older, but it doesn't have to control your life. By understanding what's happening in your spine, you can take steps to protect it and manage any symptoms that arise. In the next section, we'll look at why this condition becomes more common with age, and what factors speed up the process. 2. Why does spinal degeneration happen with age? Aging affects every part of our body, and the spine is no exception. Most people don't think much about their spinal discs until they start to feel pain. But these discs play a critical role in how we move and feel every day. As we get older, those discs begin to change, and not always for the better. One of the first things that happens with age is disc dehydration. When we're young, the discs between our vertebrae are soft, gel-like, and full of water. They act like shock absorbers, keeping our spine flexible and cushioned. But over time, these discs naturally begin to dry out, losing their sponginess and flexibility. By the time we're in our 50s or 60s, most of us have lost some disc hydration, even if we don't feel it right away. As the discs become thinner and stiffer, they provide less cushioning between the bones of the spine. This means the vertebrae can begin to rub against each other, leading to joint irritation and bone spurs, those small bony growths that can press on nerves and cause pain. Another key factor is wear and tear, also known as mechanical stress. Every time we twist, bend, lift, or even sit for long hours, we're putting pressure on our spine. Over decades, that pressure adds up. Think of your spine like the tires on a car. You may not notice the wear from day to day, but eventually, the tread wears thin. The same goes for your spinal discs. Posture plays a big role too. Many of us spend years sitting hunched over desks, staring down at phones, or driving long hours with poor alignment. This adds extra strain on the lower back and neck, accelerating disc breakdown. Inactivity can make things worse. When we don't move enough, the muscles that support our spine, especially the core and back muscles, start to weaken. Weak muscles mean the spine has to do more work than it should, which leads to faster degeneration. Ironically, the more pain people feel, the less they move, and the less they move, the more degeneration can occur. Obesity is another contributor. Carrying extra weight, especially in the belly, adds constant pressure to the lower spine. Over time, this added load can speed up the breakdown of discs and joints, making spinal degeneration worse. Then there's smoking. Many people don't realize that smoking reduces blood flow to the discs. Without proper blood supply, discs can't get the nutrients they need to repair themselves or stay healthy. That's why smokers are more likely to experience earlier and more severe spinal degeneration. Finally, we have to mention genetics. Some people are simply born with weaker discs or less durable connective tissue. If your parents or siblings have had back problems, there's a higher chance you will too. All these factors, aging, lifestyle, posture, weight, and even DNA, combine to make spinal degeneration a common part of getting older. But common doesn't mean unavoidable. With awareness and proactive care, it's possible to slow down the process and maintain a healthy spine well into your senior years. 3. Symptoms to watch for. Spinal degeneration doesn't always announce itself loudly. In fact, many older adults live with mild degeneration for years, without even knowing it. But for others, the symptoms can slowly creep in and begin to affect daily life. One of the most common symptoms is chronic back pain. This pain might start as a dull ache in the lower back or neck. It may feel like stiffness or tightness after getting out of bed, or after sitting for too long. For some, it comes and goes. For others, it becomes a constant, nagging presence that limits movement. Another sign to watch for is pain that gets worse with certain activities. For example, standing or sitting for long periods can increase discomfort. So can lifting heavy objects, bending forward, or even walking long distances. Many people report that the pain improves when lying down or changing positions. Stiffness is also a red flag, especially first thing in the morning or after periods of rest. As we age, our joints and discs naturally lose some flexibility. But with spinal degeneration, that stiffness can become more severe and last longer. One of the more troubling symptoms is radiating pain. This happens when the spinal degeneration affects nearby nerves. For example, if a disc in the lower back presses on a nerve root, pain may travel down one or both legs. This is often referred to as sciatica. Similarly, if the neck area is affected, pain may radiate down the arms or into the shoulders. Along with radiating pain, some people experience numbness or tingling, a pins and needles feeling in the arms, hands, legs, or feet. This sensation can come and go, or linger for hours at a time. It may feel like the limb is falling asleep, even when it's not under pressure. Muscle weakness is another symptom that should never be ignored. When spinal nerves are compressed, the signals between the brain and muscles can become disrupted. As a result, you might notice that your grip is weaker, or your legs feel less stable when walking. In severe cases, this can lead to balance problems or even falls. Sometimes, symptoms appear gradually and are easy to dismiss as just getting older. But when these symptoms start to interfere with your daily activities, such as walking, climbing stairs, or carrying groceries, it's time to take them seriously. Some people with spinal degeneration also report increased fatigue, especially in the muscles around the back or neck. When your spine is not functioning properly, other muscles have to work harder to compensate, leading to more strain and exhaustion. It's also important to note that stress and mood changes can go hand in hand with chronic pain. People who live with spinal degeneration may experience irritability, anxiety, or even depression, especially if their mobility becomes limited. That's why it's crucial to treat both the physical and emotional aspects of the condition. So, when should you see a doctor? If you're noticing any of the following: persistent back or neck pain that lasts more than a few weeks, pain that radiates to the arms or legs, numbness, tingling, or muscle weakness, trouble walking or balancing, loss of bladder or bowel control, which is rare but serious. Don't ignore the signs. Spinal degeneration may be a part of aging, but living in pain doesn't have to be. Early intervention can make a big difference in managing the symptoms and improving quality of life. 4. How it's diagnosed. Diagnosing spinal degeneration isn't always straightforward, especially because many people might have wear and tear in their spine without even feeling pain. But if you are experiencing discomfort, stiffness, or other symptoms, it's important to get the right diagnosis. The first step often begins with your doctor asking about your medical history. They'll want to know: when did your pain start? Where exactly is the pain located? Lower back, neck, or radiating down your arms or legs? Does the pain come and go, or is it constant? What activities seem to make it worse? Your doctor will also ask about your lifestyle. For example, do you sit for long periods? Are you physically active? Have you had any injuries to your back or neck in the past? Once they understand your background, the next step is a physical exam. This may include checking your range of motion to see how well you can bend, twist, or move your neck and back. Testing muscle strength in your arms and legs. Looking for signs of nerve problems, like numbness or tingling. Assessing reflexes, which can help determine if certain nerves are being compressed. If your symptoms suggest spinal degeneration, your doctor may order imaging tests. The most common ones are small blue diamond X-rays. These show the bones in your spine and can reveal things like narrowed disc spaces, bone spurs, or alignment problems. However, X-rays can't show soft tissues like discs or nerves. Small blue diamond MRI, magnetic resonance imaging. This test is especially helpful because it gives a detailed look at the discs, nerves, and spinal cord. It can show whether a disc has slipped, shrunk, or is pressing on a nerve. Small blue diamond CT scan, computed tomography. If an MRI isn't an option, a CT scan is another way to see cross-sectional images of the spine. It's more detailed than an X-ray but not as clear as an MRI when it comes to soft tissue. In some cases, your doctor may also recommend small blue diamond myelogram. This involves injecting dye into the spinal canal before taking X-rays or a CT scan. It helps show how the spinal cord and nerves are being affected. Small blue diamond electromyography, EMG. This test checks how well your nerves and muscles are working together. It's used if you're having muscle weakness or shooting pain in the limbs. Together, these tools help paint a full picture of what's going on in your spine. But it's not just about what the images show, it's about how those findings line up with your symptoms. Sometimes people have clear signs of degeneration on an MRI, but no pain at all. Other times, just a small disc problem can cause major discomfort. That's why a careful, personalized evaluation is so important. Once a diagnosis is made, your healthcare provider can help you explore treatment options that match your condition, your goals, and your lifestyle. Remember, the sooner you get clarity on what's happening in your spine, the sooner you can start feeling better. 5. What can be done? The good news is, there are many ways to manage spinal degeneration, even without surgery. Treatment depends on the severity of your symptoms, your overall health, and your lifestyle. Let's go through some of the most effective options. Physical therapy and movement. One of the best first steps is physical therapy. A licensed physical therapist can help you strengthen the muscles that support your spine, especially the core and lower back. You'll also learn stretching techniques that improve flexibility and reduce stiffness. Many people are surprised by how much relief they get from just a few weeks of guided movement. In addition to therapy, light exercises like walking, water aerobics, or yoga for seniors can help maintain spinal health without adding strain. Pain management. For many people, the pain of spinal degeneration comes and goes. Over-the-counter medications like acetaminophen, Tylenol, or ibuprofen, Advil, can help reduce inflammation and discomfort. If those aren't enough, your doctor might recommend prescription pain relievers, muscle relaxants, or even nerve medications like gabapentin. Just remember, pain medication should be used as part of a broader care plan, not as a long-term solution. Heat and cold therapy. Simple home remedies can also make a difference. A heating pad can soothe stiff muscles and increase blood flow, while cold packs help reduce inflammation after activity. Alternating between heat and cold is often effective for managing flare-ups. Posture and ergonomics. Believe it or not, how you sit, stand, and sleep matters a lot. Poor posture puts extra stress on your spine. Try using chairs with proper lumbar support, sleeping with a supportive mattress, and avoiding slouching, especially when watching TV or working at a desk. Some people find relief using orthopedic cushions or adjustable beds. Weight management and nutrition. Carrying extra weight puts more pressure on your spine. Even losing 5 to 10 pounds can ease strain on the lower back. A diet rich in calcium, vitamin D, and anti-inflammatory foods, like leafy greens, berries, and omega-3 fats, can support both bone and joint health. Drinking plenty of water also keeps spinal discs hydrated. Lifestyle modifications. Smoking, believe it or not, has been linked to faster disc degeneration. Nicotine reduces blood flow to spinal tissues, which can slow healing and worsen symptoms. If you smoke, quitting is one of the best things you can do for your spine. Also, try to avoid heavy lifting or twisting motions that can aggravate your condition. Alternative therapies. Many older adults also explore alternative treatments, like chiropractic care, acupuncture, massage therapy, or Tai Chi. While results vary, some people report less pain, better flexibility, and improved mood. Always talk to your doctor before trying these methods, especially if you have other health conditions. Injections and advanced treatments. If pain is severe or doesn't respond to conservative treatment, epidural steroid injections might be an option. These injections reduce inflammation around nerves and can provide relief for several weeks or months. In some cases, nerve blocks or radiofrequency ablation are used to target chronic pain more directly. Surgery, the last resort. Surgery is usually only considered when all other options have failed. It may be recommended if there's significant nerve compression, spinal instability, or loss of function. Common procedures include spinal fusion, laminectomy, or disc replacement. These surgeries carry risks and require recovery time, but for some, they can bring life-changing relief. Spinal degeneration is a natural part of aging, but that doesn't mean you have to live in pain. With the right care, support, and lifestyle choices, many older adults continue to stay active and pain-free. Thanks for watching Health 999, where your wellness matters. Don't forget to like, subscribe, and share this video with someone who might need it.